Alrighty, thank you all. Let's see a lot of familiar faces. I apologize that you have to listen to me again, and you might have to listen to me again later as well, so I do apologize. My name is Dallas Allen. I'm the Suicide Investigations and Postvention Specialist at the Franklin County Coroner's Office. I'm not going to go into my full bio, as a lot of you have already heard it, and I'm not that interesting anyway. So I would just say what I do is I conduct investigations into suicide fatalities in Franklin County, do full psychosocial investigations, which is similar to a psychological autopsy, but we just do it a little bit differently as we are within the Coroner's Office. I'll pass it over to Nicole and let her introduce herself here in a few, but I'm just actually going to talk a little bit about our objectives and kind of show you what we're going to be talking about a little bit. So first, we're actually going to discuss the background of our presenting counties in reference to the Suicide Fatality Review, and then we're going to be diving into Franklin County and Huron County specifically and how we do our approaches differently, just to kind of give you an approach on how it can be done in different ways, and we can still accomplish that common goal that we have. We're then going to explore roles and responsibilities of the SFR Facilitator specifically, and how it differs between each of our counties. We're then going to examine how the fatality review meetings are conducted in each of our counties, and discuss how we do our tasks before, during, and after the fatality review. And then finally, we're going to review some really important documentation that can actually help you move along in the process of your suicide fatality review. So Franklin County, just to give a little bit of kind of the stats. So I'm sure most of you are aware, Franklin County is located in central Ohio and is the central county of the Columbus Metropolitan Statistical Area. Franklin County is the most populated county in the state. In 2023, we had an estimated population of 1,326,063 residents. In addition to being the most populated, we're also one of the most diverse populated counties in the state of Ohio. Our largest city is Columbus, of course, which in 2023 had an estimated 913 and 175 residents. And then lastly on this slide, our major industries include healthcare and social assistance, the retail trade, as well as educational services. The Franklin County SFR is a stand-alone committee, meaning that we only review suicide-related fatalities at our meeting and have separate reviews that focus on other manners of death, such as overdose, child, infant, those other fatalities that exist around the state of Ohio. Our SFR is facilitated by the Franklin County Coroner's Office. I am the facilitator of the Franklin County Suicide Fatality Review. And our first actual meeting was actually conducted on September 3rd of 2021. Our committee was established prior to that. We actually predated the legislation. But the first actual meeting that I was a part of was September 3rd of 2021. Franklin County's SFR committee was actually, like I said, created before that legislation. So I don't know. I know some of you were in my previous presentation, and they talked a little bit about it in our keynote through Ohio Department of Health. Since we were one of those two counties, everything that we do is going to be unique as we predated that. So being that facilitating through the coroner's office is one of them, another one being that I am also the chairperson and the facilitator, all of those things that necessarily cannot be done now because of the legislation that is in place has clear requirements on who should conduct them, who should lead them, be the chairperson and facilitator, and et cetera. Talk a little bit about the members, and I'm not going to go through every single one of them. But these are just some of the agencies that are involved on our review permanently. So some of these are those mandated agencies that were just discussed in the previous presentation, but not all of them are mandated. But these are ones that are on each of my reviews. So they're going to get an invite each time that we have one. These don't include those agencies that we're going to add at will for each review to provide additional beneficial discussion. Each time these will be involved. And so we tried to make sure that we had a wide array of expertise and outlooks on just mental health and suicide prevention specifically, so that overall that can improve our overall quality of those recommendations. I'll give a couple more seconds for you guys to read those. Alrighty, so now before I pass it over to Nicole, I'm going to just go over the overall process of the Suicide Fatality Review in Franklin County. So our meetings are conducted on a quarterly basis and are conducted virtually. We've tossed around the idea of being in person, but just since we were actually starting a lot of our reviews during COVID, it was difficult to come in person, and it's just worked for us thus far, so we didn't really necessarily want to change it. I didn't want to decrease the amount of buy-in that I received, because now, hey, I'm like, hey, you got to actually come in person now, you're going to have to come to the coroner's office and things like that. So we just kept it how we were doing it, and so all of ours have been virtual, and we just don't see us changing that anytime soon, as it just typically worked for us. I'm typically trying to line up the meetings for one of the first 2 weeks following the end of the previous quarter. So for example, for a quarter 2 review, I'm going to attempt to conduct that meeting on the first or second Friday in July. I do it on Fridays for various reasons, one being just self-care, right? We're talking a lot of detailed, traumatic information, and so just putting it on a Friday so that we can kind of put a capstone on the week after we conduct that meeting, and then have the weekend to kind of do something for ourselves and take care of ourselves after doing this information. So we just felt Fridays were the best to conduct those meetings for us. We're going to review 2 cases utilizing my full psychosocial investigation that I talked about a little bit before. So those reports are going to be extremely detailed, and therefore it does take a really long time to look into one case. And so we went ahead and just selected 2 cases, and in each of my reviews, we've done 2 cases, and that's taken up the entire 2 hours of the meeting. So to just do more just doesn't logistically make sense. I feel like if we did more, we would have 4 to 5 hour long meetings, and that just wouldn't bode well for my committee members. And so we just stayed with the 2. The information that's being reported on throughout that psychosocial investigation is going to include interviews with survivors. So not just next of kin, but I'm also going to take a little bit deeper dive into family, friends. I'm looking to see if I can connect with coworkers, just as much as possible to understand the decedent and their life experiences, to allow us to be better informed on what we can do as a community to interact with someone who may be in a similar situation and prevent a future suicide from happening. In addition to that information through the interview with the survivors, I'm also going to be looking at public records, social media. Because I am within the coroner's office, I can also send subpoenas, so I'm going to collect the medical records and include those into my investigation. And then really any other outlet that may be available to collect that information and that deep dive information related to the decedent. Case selection for our reviews is essentially decided on trend data. And what I mean by that is when I'm looking into what cases we want to utilize for the review, I'm trying to pick out cases that are either in at-risk populations in which we're seeing an increase in suicide within that community, so that we can, as close to real time as possible, figure out what we can do as a community to change that number, to get out in front of it. For example, in Franklin County in last year, we were seeing a huge increase in suicides within the Black community. And so what I did, I made sure that we did a review of individuals who identified a part of the Black community so that we could see what is a common factor, what's going on, what can we do as a community to prevent suicides within that community. So that's what I kind of mean by that trend data. And so with my position, I'm continuously auditing the cases that come in, and so I'm able to see what our suicide numbers are looking like, and that's how I choose those cases. My last point on this slide is the fact that the Franklin County Suicide Prevention Coalition is positioned as the actionable arm, and I know some of you had already heard about that in my previous presentation, but we were just trying to figure out what is the best way that we could help with the implementation of the recommendations that actually come from the fatality review. And so we identified the coalition as the actionable arm, which means they're a subcommittee of our Franklin County Suicide Fatality Review. We utilize the 3 action teams to categorize the recommendations via social ecological model and then track the implementation of those recommendations into the community. And then we also include all of our recommendations in the annual action plan for suicide prevention for Franklin County, which is completed by that coalition as well. Now I believe I'll now go ahead and pass it over to Nicole.
All right, so my name is Nicole Marks. I'm the Community Programs Division Director at Huron County Public Health. For Huron County, obviously we're kind of total opposite end of the spectrum as Franklin County. We are a more rural county. We're located in north central Ohio. We have a population of about 60,000 residents, and our largest city is Norwalk with only 17,000 residents. And much different to that of Franklin County, our major industries are more in the line of agriculture and manufacturing. So our overdose and suicide fatality review committee is a hybrid committee. And so it's a combined SFR OFR that is facilitated by us at the health department. We've been meeting for about 2 years. Our first meeting was held in July of 2022. And while we were currently unfunded, we will receive $10,000 in state fiscal year 25 through the Ohio Department of Health Youth Suicide Prevention Grant, as that was one of the grants that ODH had just talked about in the previous talk. So this is what our SOFR committee makeup looks like. For those of you who are just in the last breakout session, I apologize again, some of this is a repeat. But at the table for us in Huron County are the health department, our MHOS board, our coroner, law enforcement agencies, first responders, our prosecutor's office, mental health and substance use treatment agencies, veteran serving organizations, a funeral home, a hospital, and our Department of Job and Family Services. And so our meeting cadence is also quarterly. It's in person only, so a little bit different than Franklin County there. We're reviewing suicide and overdose related deaths that have occurred 2 quarters prior. So we kind of have that built-in time lag to give people time to get documents around and really prepare for the meeting. We are very small, so we're lucky in that we have small numbers as well. And so with that, we try to review every single case of suicide or overdose deaths that occur in the county. In 2022, that was 9 cases. That was that half year for the first year. 2023, we reviewed 23 cases. In 2024 through July, we had reviewed 15 cases. So again, we're the Suicide Fatality Review Facilitators, both for Franklin County and Huron County. And so when we were developing this presentation, we just kind of wanted to walk through what we do before the meeting, during the meeting, and after the meeting, kind of helping someone who might not know where to get started, kind of what the whole facilitator process looks like. So I'm going to turn it back over to Dallas.
Alrighty, so now we're going to talk a little bit about what we do in Franklin County leading up to the Suicide Fatality Review. So I touched on this a little bit. So as suicide deaths are reported to our office, I'm going to attend the scene. I'm going to assist in the forensic investigation to a degree that is dictated by the forensic investigator that I am assisting. So each scene that I'm on, I am assisting to the degree like I'll do equipment handling, scene clearing, I can collect evidence. I'm very similar to a forensic investigator. I'm just necessarily not taking the photos. I'm doing everything but taking the photos. And then the most important thing that I'm trying to accomplish on scene is connecting with that survivor. Whoever was then exposed to that suicide. Not only am I trying to obtain information related to the decedent that helps with the investigation, but most importantly, I'm trying to connect that individual to resources. As a suicide loss survivor myself, that is how I approach my scene responses. It's the utmost importance for me. So if I'm on scene and the family isn't necessarily in a state to provide me with information, that is 100% okay. I'm going to make sure that they are connected with services, that they understand what is to come, unfortunately, now being a suicide loss survivor, and help navigate that as much as possible with them. I keep an updated, ongoing spreadsheet of all of that information that can related to the case. So demographics, injury location, the mechanism that was used, any additional information related to mental illness or suicidal ideation, previous non-fatal self-injury events, any of that, those things that can help impact not only the certification of that death, but information relating to the Suicide Fatality Review in the future. That spreadsheet is going to keep all of that in place, and so that's what I'm utilizing when I'm looking at that trend data that I had already mentioned, because I'll be able to see which demographics are having an increase, which ones are decreasing, and then also within those at-risk populations or demographics that are increasing, I can look at those factors, that psychosocial factors, and see where the commonalities are in that as well. And so that helps not only inform the fatality review process, but inform my stakeholders and partners as close to real time as possible, instead of having to wait to the end of the year, collect all of that information, and then try to inform them for prevention efforts. I'm actually able to inform them when I'm seeing the trend, which we've just seen to benefit us in Franklin County. So either on scene or following the scene response, I'm going to complete that psychosocial interview, which, like I said, is similar to a psychological autopsy. I'm going to investigate stressors that may be present within someone's social dynamics, education and occupation, physical and mental health history, criminal history, substance use history, suicidal ideation, as well as any other stressor that might not fall within one of those identified categories. I also want to say, if your committee does not have access to this type of deep dive, other options could include seeking more involvement from your coroner's office. Now, you'll see if you guys choose to sit in on the mock later, I get to represent the coroner, so I get to act bigger than my britches. But that case, what I'm reading is actually just the investigator narrative. So I'm not including that psychosocial investigation. But you'll see that the investigator themselves, when they go to the scene, they're collecting very important information related to that decedent, the case itself, and it can really inform your fatality review. And so I say trying to reach out to your coroner's office to see if they can include that scene narrative so that you have that information for your fatality review as well. Following the interviews, I'm then going to complete that psychosocial investigation with all those additional outlets that I've mentioned before. And then my report process is typically done in stages. So stage one is going to be that investigator narrative, and then which is completed with all of the facts that are just known on that scene response. So we don't have medical records yet. We don't have any of that additional information that I'm obtaining from other outlets. This is just from that scene response. So if we were able to get medical history from family and stuff, that would be included. But if not, we're just getting that information related to the scene findings. So we're more relying on the scientific evidence and facts so that we can help the pathologist with that certification of death. Stage two is when I'm actually going to collect all of that additional information through public records, social media, etc. And then the final stage is when I'm going to bring all of that information from start to finish in a full psychosocial report, and that report is what I actually utilize on the suicide fatality review, and that can be anywhere between, on average, 5 and 6 pages. I've had some that have surpassed 10 pages. So it just really depends on what information is available about the decedent and their life experiences. Just a little bit of continuation of what we do prior. So next part of the process is case selection. So as I mentioned, at that point, I'm then going to look at all of the cases, determine which cases are best suited for the review and which cases I believe are going to elicit very important conversation and help us create recommendations into the community for actionable change. Lastly, it's time for me to start preparing for the actual meeting. So 1 month prior, I'm actually going to send out the meeting date, a reminder to the committee so that they can clear their schedules and be available for that meeting. About 1 to 2 weeks prior, I'm actually going to contact my team again, and this time I'm actually going to send out the case information. So when I'm reaching out to my team a week or two before, this is the information that I'm providing them so that they can actually collect all the appropriate information so that they can come prepared to the meeting to share on any involvement that they may have had with the decedent. That's typically what I send out is going to be the coroner's report as well as the toxicology findings. That's going to allow my team to go ahead and start preparing. In addition to that, I'm going to send out an agenda for the meeting, so the things that we're going to cover, as well as trigger warnings at times. So there's some times where I'm going to be presenting on a case where I have 10 pages of information that is very detailed and traumatic information related to that decedent and what they'd experienced leading up to their death. And so sometimes when I'm going to be doing that, I make sure that my team is aware of that so that they can choose to either be a part of that or maybe step out. I talk about, I always say at any point you can go ahead and turn your camera off and step away. Of course, I encourage reapproaching the meeting after you take your time, but self-care is really important to me. And so if I know that the case is going to do that just because of some of the circumstances through the investigation, I will up front provide that trigger warning so that they're aware of it prior to the meeting. I believe I'll now pass it back over.
All right, so that prior to the meeting, again, looks a little bit different for us in Huron County. We don't have that on-scene piece, right? So one thing that will be new for us is we do have a crisis response team that does go out, but that's very new for us. It just started as of July 1, and so they're not yet incorporated into this process, but that's a goal for myself moving forward, is that they become incorporated in the review process. So kind of what my prior to the meeting looks like is establishing a meeting schedule for one. That's something that we've found is helpful to get people to the table. At the end of the year, we'll put out the meeting schedule for the whole next year so that they have more than enough time to block that off and make it a priority. So for us, we meet the final Wednesday of the first month of each quarter, and then our follow-up meeting, which is a crisis response committee, we meet the following month. So we're at these SOFR meetings looking specifically at cases and then formulating recommendations and things that we want to address as a community. And then the following month, we're meeting as the wider group to talk about what recommendations and things that we want to actually change in the community. So one of the questions I had when I got started was just, how am I getting the cases to review? And so for us, again, being very small, it just looks like working with our vital statistics office within the health department. So I have our vital statistics office just kind of scanning through all the death certificates as she gets them in. If she has one that's attributed to a suicide or an overdose, she lets me know essentially. So she'll print me off a government copy of the death certificate, and I'm adding that to an internal data spreadsheet and kind of keeping a log of the cases that we have to review. And then I'm also just keeping that death certificate in a physical binder until our case review is complete. And then about 1 month prior, so as Socrates mentioned, you need to make sure that there's no conflict with the prosecutor's office or the sheriff's office as far as an ongoing investigation. And so once I get those cases compiled on my spreadsheet, I'm sending those over to the prosecutor's office and the sheriff's office about a month or so ahead of time just to say, hey, are these cases all good to go? We've had a couple instances where they weren't, and so I just pull those off and hold those to later and ask that they inform me when we're okay to review those, and we'll put those on down the line. Once I have the okay from those two offices, I'm sending out a list of requests to partners, so hospitals, mental health providers, EMS, etc. And if you have your review guide, that's Appendix D, there's kind of a pre-meeting letter that kind of shows you what that looks like. We also have our MHOS board that has the capability to do psychological autopsies, so as time allows, she's doing those as well because she's getting that list. But as of right now, it's just a time constraint for our county to be able to do those psychological autopsies for every case. As Dallas said, I'm also looking just kind of on social media to see if there's anything that I can find out about the decedent. I'm compiling their obituaries. That oftentimes has some useful information as well. And then just kind of the logistics of the meeting. So I'm preparing a case review form with the information that I received prior to the meeting. So we may receive information from some of our partners when we send those letters out, and they'll just mail it back to us in lieu of actually attending the meeting. Other partners may send it in and attend the meeting. Other partners may just attend the meeting. So getting together ahead of time what I can and what I have is part of my prep for the meeting. And then just a basic sign-in sheet with a confidentiality clause at the top as kind of a reminder as everyone's entering the meeting. And then similar to what Dallas said, about a week prior to the meeting, I'm sending a meeting reminder and the actual agenda, which is a list of cases to be reviewed for those who might not have had time to get stuff around prior. That's another kind of prompt for them to get their information around for the meeting. So best practices for meeting preparation, a couple things that we wanted to recommend. Again, psychological autopsies or next of kin interviews leads to a more in-depth conversation. It increases the likelihood of finding systematic gaps. So if you have the time, energy, funding to do those like Dallas does, that's invaluable information that can be added to the conversation. Again, scheduling those meetings far in advance and using a consistent recurring meeting cadence might lead to increased attendance. If they're going to prioritize it and put it on their calendar a year ahead of time, that might lead to some wins as far as attendance goes. And then with that, I'll pass back over.
All right, now we're during the meeting. All right, so during the meeting in Franklin County, we're going to review one case at a time. So I typically start with each case by reporting on the coroner's report as well as the toxicology report, and then I'm actually going to review all of the circumstances related to the death, so that's that scene narrative. So I'm actually going to provide the investigators information that they collected on scene from a forensic standpoint, which is why I have a photo. That's actually me with some of our investigators, so they helped me a lot in the process, and so I wanted to make sure that I throw a photo up there as well. After I go through the scene circumstances, I'm then going to also read my full psychosocial investigation. So that's that full 5-6 page report in which we do that deep dive information related to the decedent and their experiences. After reporting on the case, I'm then going to go around to all of my committee members. So anyone who is in attendance during the review, I'm then going to go around and give them the opportunity to speak on any involvement that they may have had with the decedent. So we'll just go around, and if they didn't, they just say, we didn't have any involvement, and then we just move on to the next agency. And if they did have involvement, that's when they're going to read their summary of their records that they have and just provide what their connection was with the decedent, and what was the outcome of that. Did they just discharge them to additional services, just so we know and can have a timeline of what the services were for that decedent. After that roundtable, and we go around to see if there was any involvement with any other agency, that's when we're going to then open the floor for that collaborative discussion. So this is when I just give the floor to the team, right? I take a back seat at this point, and I just want to hear everyone else's perspective. What stuck out to them when I read my report? What did they think was something in which, as a community, we possibly can improve on? What did they feel like was something that if we were able to connect this decedent at this time, it would have been extremely vital in their life path? Things like that, just so I can actually hear from everyone else. And that's why when you think about who's on that committee, having a very diverse committee is going to lead for that conversation to be more expansive and actually give you, really good perspective, as they might have lived experience, might be closely related to the situation that we're reviewing, and give you information that you might not even be thinking of when you're facilitating that. And then after we do that, we're then going to continue to have that floor open, and we're going to talk about what they feel could be an impactful recommendation. And so again, the floor is given to the team. These recommendations aren't just created by me. They're not necessarily just coming from my report. This is coming from information for everyone on the team. And I feel like that's just helped us when I'm able to give the floor to the team. They feel more empowered to be a part of the conversation. And so that's when we're then going to compile that list of recommendations, which I'm documenting and making sure that we're listing all of them so that I can report them to our coalition, which I'll actually talk about here in a few. I'll pass it back over.
All right, so during the meeting, the process looks very similar to Franklin County. We open the meeting with opening remarks, reviewing our ground rules, giving a confidentiality reminder, having any discussions from follow-up from last time if we need to. If it's the time of the year to talk about the annual report, we'll talk about the annual report. And then we jump right into our case reviews. Similar to Franklin County, we kind of present that basic case information, what we've gathered from the death certificate, the obituary, and any records that we've received of people that were not present at the meeting but sent something in ahead of time. And then we really like to turn it over to the partners and let them present their own case information. And then we're kind of documenting that as they speak. But again, turning the floor over to them and really letting them speak for their experience with the decedent. And then, as Dallas said, discussing identified gaps and recommendations for each case. So best practices, and one of the things for me that's been probably the most difficult is keeping the meeting on task. You can get into a ton of great conversations from these cases, right? But it's hard to keep them on task and not let that take away the whole meeting, especially if that's your first case and you're having great conversation. So again, we kind of established that second meeting as what works best for us of, okay, let's keep these case reviews very specific to the cases and then come away with like broad recommendations or broad things that we want to address. And then in that larger meeting with the crisis response committee, we're talking about, okay, let's take these recommendations and how do we actually want to put boots on the ground and address these issues in our community. And I think it's kind of similar in Franklin County. As Dallas mentioned, self-care reminders for committee members are very important to their own health and well-being because it can be very heavy and it's not a fun meeting, but it's important work that we're doing. And again, giving partners that ownership in the process by allowing them the time and space to report their experiences and their interactions really has helped us feel like our partners are actually bought into the process. We don't have issues with attendance because they're all bought into the process and they're seeing the process work and they feel like they're invested into the process. So after the meeting.
Well, we're just moving along here. So now we're after. It doesn't go this fast in real life. I do apologize. It does take a lot more time for before, during, and after. I wish it went this fast. Alrighty, so this is probably going to be some overlap, some people that might have heard from me earlier. But after our meetings are completed, I'm going to utilize a case review sheet where I'm actually going to document all of those recommendations. Like I said, in the meeting, I'm documenting them, but a lot of times I'm using like shorthand just so I can make sure that I'm not missing anything. The case review sheet is actually where I'm going to make them more legible, try to turn them into a more actionable recommendation and not just a paragraph of information that we discussed within that meeting. That review sheet is also going to have spaces on the bottom of it where I can document those recommendations in certain categories. So right now I have a lethal means restriction category, I have a therapeutic category, an education category, and then an other. So anything that might not fall within one of those categories. And so after the meeting, I'm just trying to determine, was that recommendation more about a therapeutic intervention? Or was it more about increasing education to the community about resources that are available, those types of things. So I can already start that categorization process so that when I move it forward to the coalition, we're already starting that categorization, and then I actually receive feedback from the coalition. So, as I said, collaborating with the coalition, which that photo is actually some members of our coalition where we all work together when it comes to the recommendations that come through the fatality review. So this is when we're now a couple processes in, and we're just trying to even more make those recommendations more digestible, right? Because if I send a whole paragraph to a stakeholder and I say, implement this, we're going to change the suicide numbers that we're seeing, they might be a little bit reluctant to even read it. But if we can actually shorten it, make it very actionable, and actually give them steps as to how they can implement this into their daily operations, we've just seen it a little bit more easy when we're having that conversation. And so that is where I rely on the 3 teams within our coalition, which is the communication, education, and data and research. So these are 3 teams that have very different perspectives, expertise. They come from a lot of different agencies, and they volunteer on this team. And so I present the recommendations to the data and research as I'm a volunteer. I sit on that as well as I'm on the advisory committee. And so I provide them with the recommendations that have been created. The data and research team then work to categorize them and then put them within the socio-ecological model. And then we rely on the other 2 teams to help implement those. So if it's an education, what can we do about increasing education? We're going to make sure we move those recommendations into the education team, and they're going to work to implement those into our community. And then the other team for communication, alerting, certain at-risk populations about available resources, things like that. Advertising, marketing about resources that are available, those types of things will funnel through the communication team. In addition to following up with those created recommendations that I was talking about, I also continue to check in with my team. I try to be a leader in that space and make sure that they understand that I am there for them as well, and that they can have an open conversation with me related to how they're feeling, and just give them an open line of support. Again, being a suicide loss survivor, a lot of how I approach this is making sure that my team members are doing okay. Because again, this information is secondary trauma at this point, and now a lot of people are signing up to this and just willingly exposing themselves secondary to suicide. And so I just want to make sure that they're doing okay as well. And so I make sure that they know they can reach out to me. If they would like a break for a couple meetings, they can reach out to me and they can ask for that break, and there's no problem with that at all. And I'll just remove them from the email communication, and then when they're ready to be back in, they can reach back out to me and I'll put them back in, just so that they know that they're not forced to receive this information. They're not forced to be a part of this and expose themselves if they're not feeling quite right. And so just that open line of support is extremely important. And then also throughout the time between completing a meeting and then getting ready for the next one, I'm going to take a look at my team and think about the gaps that maybe we're missing. Who is at the table or who isn't at the table? What perspectives could I add to improve to the recommendations for the next time? And so a lot of times in my meetings, I'll say, hey team, if you have any ideas of people who you would like to see be a part of this, you think their perspective is being missed throughout our conversations, feel free to send their contact information over to me. And then as the facilitator, I work to reach out to that agency and then set up my process for recruiting, set up an interview with them so that I can understand who that individual is and what agency they represent, and then we'll bring them to a vote into the committee, and we'll bring them apart if they would like to. And now I'll pass it.
All right, so follow up for Huron County, just some logistics again, like scanning and saving the sign-in sheet, trying to keep documentation as minimal as possible, but keeping what we need to keep. As Dallas mentioned, that case review form is going to be really important. So I'm kind of going back through the case review form to make sense of the notes that I quickly jotted down during the meeting and making sense for myself. One thing that I wanted to mention here is the annual report. So Socrates talked about the annual report requirements, and that's something that we'll talk a little bit more about at the end of the presentation as well, but just keep that in the forefront of your mind too as you are documenting, because you need to help yourself out by documenting what you need to document, because if you don't, it's really hard to go back and kind of find that information or remember that information when you've done a year's worth of reviews. So with that case review form, just making sure that I document what I need to for the annual report in addition to those recommendations for the other committee. Collaboration with the Huron County Crisis Response Committee, again, that's that second group that I'm talking about. So this is very focused on our actual cases, and then the Crisis Response Committee is more focused on taking the broad recommendations and actually putting boots on the ground and making changes in the community. The collaboration's easy because I head up both groups, but it is nice to kind of have that very clear separation of the two groups so that we can kind of stay on task. And then as Dallas talked about, continued recruitment to address the needs of the committee. As you start to see trends in different things, it's easy kind of to identify sometimes maybe, oh, we're missing this person or that person. An example for us recently was we had, I think, 3 quarters in a row where we had a veteran suicide, and we didn't have any sort of veteran representation at the table. And so we looked and said, you know, who can we have at the table? So we added our veteran service officer from our county, as well as a representative from the VA who is a suicide prevention specialist for our region. So best practices for meeting follow-up. Again, you want to continuously reevaluate your committee's membership. Think about adding new membership or inviting guests as gaps are identified. And as Dallas said, that kind of may ebb and flow. Sometimes, you know, we're seeing a lot of turnover in our fields, and someone may fall off and the new person may never come back on. So we try to once a year just kind of look at our committee and say, who do we need at the table that we don't have? Who needs re-invited back to the table, or who, you know, maybe they're on our committee technically, but they never show up to meetings, they never send documentation, so maybe we just need to go ahead and remove them from all of our correspondence. Again, you want to make sure that you're keeping your case specifics confidential per the ORC and only discussing recommendations with the other groups and committees. Again, for us, this has kind of been a problem of why we separated those two committees, is because there was a lot of concern that what was happening in the review meetings was going to go to the larger community, which is why we just made it very clear, like, what happens in the review is staying in the review, and it's only the broader recommendations that are going to that second committee. And consider asking for assistance with documentation. I don't really think either one of us do this very well, but if you have someone that you are able to have help you with documentation during the meetings, that could be helpful so that you're not trying to both facilitate and document and keep everyone on task and keep the meeting moving forward. And I'll pass over to Dallas. He's going to talk a little bit more about the documentation.
And I'll also reiterate, please ask for help. So I've been doing this since 2021, like I said, and being the chairperson, being the facilitator, being the one who's documented the recommendations. I'm also going to the scene for, you know, for the deaths. I'm collecting all of that information, getting all, I mean, it can be very overwhelming at times. I'm just starting to be good at asking for help. And so I have incorporated people from the coalition to kind of be on both committees, so they sit with me on the fatality review, but they're also a part of the coalition, so that they can help me with documentation of the recommendations. And so I've just been relying heavily on myself, and I feel like at times I could possibly have missed something. And so I then try to take a look at, like, who can I trust within my committee that can help me with this process to make it easier on everyone, and then also make sure that we're not missing recommendations, right? Because that's the overall idea of this, is to collect those recommendations, and I was fearful if I was missing them, what if that was a really important recommendation and I just somehow missed it, didn't document it, and then we don't work to implement that under our community. So please ask for help, have people assist you in the process, as I'm now doing that and I feel a little bit less stressed. So I'm appreciative for that. So first, when we talk about documentation, we'll talk a little bit first about guiding documents. So these are documents that are just going to help you with the process. And so the Ohio Suicide Fatality Review Manual that we all put in our folders today, which we were working really, really hard to get that done by this, and I'm very thankful that it is, because I think with a lot of information that you learned today, you can also go back and look into that review manual, and you can continue just really improving your process, or starting the process if you haven't yet. And so make sure that we're having that as we're looking into, because it's going to give guidelines on how to develop that. It's going to help with implementation as well as evaluating all those things that we're talking, which have all been ideas that we will continuously talk throughout the day. This review manual is going to give you kind of the help with all that as well. And then in Huron County, they actually have their own kind of review manual. They call it the implementation guide. And so this is actually going to outline the legal authority, purpose, membership, meetings themselves, the review criteria, maintenance of the information, meeting format, and etc. So it's like their own developed, individualized review manual, so that they can utilize that as they're bringing on new members, and it just really helps them with the process moving forward. Important forms. So these are all going to be forms that can just really help with the process, help you with organization of the meetings. And luckily, a lot of these are actually appendices in that review manual that you received today as well. And so you can actually look at examples of how they go about those documents. Now, those are just examples. You do not have to just keep them exactly like they're in that review manual. You can just see that this is the idea, and then you can construct it to be in line with your community specifically. So a member an invitation letter, member invitation and recruitment letters, what I'll speak about first. So this is what you can utilize when you're reaching out to those potential partners. This allows you to let them know what the review process is, because this might be the first time they ever hear of it. And so this recruitment letter can give them a little bit understanding of what the purpose is, what will take place in the review. You can discuss the legislation a little bit, as they might have questions related to what they can bring and what they cannot bring and those types of things. Information request letters can also be important when you aren't able to obtain this information through a subpoena. So in Franklin County, I'm aligned with the coroner's office, meaning I do have subpoena power, so I'm actually able to subpoena those medical records. But a lot of times, now going forward, the legislation is going to be every time, right? Because you can't facilitate it through the coroner's office. Obtaining the medical records could be a barrier for your review. And so having those information request letters so that you can reach out to these agencies and get that information so that you can then provide that to your committee. A pre-meeting letter or agenda, which is kind of what we discussed that we kind of both utilize. This is what we're going to send out to the committee leading up to the meeting. And so this is also going to help you keep on track, right? We talked about keeping on track, expansive conversation, which is all good. But if you're on case one, and I'm now an hour and a half into case one, and now I'm neglecting case two, right? So I want to make sure that I'm keeping on track, and so I'm always following the time and making sure that we're in line with the agenda. And if we're like getting close to time, I always tell them, if you have any additional recommendations or you wanted to talk about additionally, reach out to me. We can do a little follow-up meeting, and we can discuss it, and I can make sure that your idea or your recommendation is documented. But we just need to make sure that we're staying on track so that we can give case two the same amount of attention that we're giving case one in Franklin County's approach. And then again, they'll reach out to me after if they have some additional information they would like to share. Another important document for meetings that are conducted in person, so this wouldn't necessarily be something that we would utilize in Franklin County, but this is that sign-in sheet so that you can track attendance to your meetings. And then also on those attendance sheets, you can actually provide them with a confidentiality reminder. So each time that they come to the review, you're just showing them again that, hey, it's really important that you keep this information related to the decedent and their family confidential, that you do not remove any information related to the decedent specifically from this meeting, and just remind them that you can only leave with what you brought here, just so that they're aware of that and don't try to do something and share information as they seem fit. And then lastly on this slide, again, is that idea of that confidentiality and data sharing agreements. So the confidentiality agreement is a must. The ORC has strict guidelines related to confidentiality and what can and cannot be shared out of a fatality review. So again, you want to definitely have one of those for your committee so that you can provide each member. So every single member on the Franklin County Suicide Review Committee has signed a confidentiality. It outlines what that means. It gives them guidance within the ORC as well. And then data sharing agreements if you don't, if you receive some pushback from an agency because they say, well, I don't feel comfortable providing that information. I don't know where it's going. I don't know what you're doing with it. That's when you can kind of, utilize an MOU or a data sharing agreement so that they can feel a little bit more comfortable with that information. And again, you can have that conversation related to the legislation so that can help you entice them to be willing to provide that information. And like I said, all this information and all these documents, examples of them are in the appendices. And again, it can be tailored and changed to fit your community because not every community can do it differently or do it the same. As you see, Huron County, Franklin County, we do it extremely differently. And so just the idea of being able to change these documents can help with each committee. Well, we're not working here. There we go. I'll just use that. Alrighty, some case related record keeping. So also in the realm of documentation, there are times that you're going to be collecting information that has case specifics on it. So it's going to be that coroner's report, the toxicology report, information related to that decedent. Another example could be the government copies of that death certificate so that you can pull information from that and then provide your committee with that information. But it's important that you keep that information extremely confidential, right? So it's about what can we do to securely keep that information. I think it's you guys, you destroy it, right? After they collect that information from the death certificate, and then they completely destroy that so that there's no way that that information can be shared outside of that setting. A data spreadsheet could be utilized to compile those basic demographics. Like I mentioned, I utilize that so that I can see the trend data, and I make sure that that is password protected. It's within our coroner's online system that only I would have access to. And then any physical copy related to any case, I have a filing cabinet which I have the only key to that, and that's just a way that I can stay in line with that security measure and ensure that that information is not provided to anyone except for me and then into my committee within that closed review setting. And then I also mentioned that case review form. So that's going to have case details on it. It's going to include those recommendations, but it's also going to have the demographics and everything related to the decedent so that we can have everything in one place, but also ensure that that is confidentiality, that that's not the document that you would then provide to stakeholders because the recommendations on it. You got to create a new one. That's just more for in-house being able to see, okay, this was a recommendation and it falls in line with this individual because they fall within this demographic, this at-risk population. It's just a different way to look at it, but that is never given to anyone else outside of me in Franklin County. In your report that we said we would discuss a little bit, so you've already heard of this, so I'm not going to go into too much detail about it, but this is just the information that's being provided to the Ohio Department of Health by April 1st of every year regarding the cases that were reviewed the previous year, and then any recommendations that was created. And I know we had a question in our last keynote about seeing previous reports. So that annual report is public record. So that information is available to be shared to the public or shared to any individual who would like to see it. So for instance, my annual report is on the Franklin County Coroner's website. So you can actually just go on there, there's an annual report section, and you can actually just pull it up and it discusses the recommendations that were created for the year of 2023. Now, like I said, I don't know, once ODH gets it, I don't know how they're kind of giving it out, but for each community we have one, and then there's no case specifics on that. There's some data points of the cases that were reviewed, but it's all just recommendations. And so there shouldn't be a reason as to why you shouldn't be able to see any of the previous ones. And then again, all active SFR committees, which Tiffany gave the number, we're not all reporting at this point, but hopefully we'll get there, just so we can see that overview. And it sounds like Ohio Department of Health is on board to help with these recommendations and just help with the overall process, which I think is extreme benefit to every team, being able to say what's going wrong or what barriers you faced, and have them be behind you and help you with that. I think it's really important. RedCap is the online reporting system that the Ohio Department of Health is utilizing for that reporting. So you can actually find that on the ODH's website, and essentially it's just compiling that aggregate data for further analysis. And then some essential components of that RedCap is going to include providing a cover page, table of contents, overview of your suicide fatality review, the data and findings from your suicide fatality review, identified trends, recommendations, and the next steps, which approach your fatality review is going to have. And that's where you can kind of talk a little bit about those barriers. And then again, like I said, there's guidance on their website, but also within the review manual that you had, it talk about it and will link you to the appropriate website as well. And I think that's all we had. So I appreciate you guys. You guys have any questions or?